Welcome to Healthy Glycans. In this podcast, we look at how glycans can guide us towards preventive healthcare and longevity, as seen through the lens of SynHealth, a new-funded project turning glycan biomarkers into personalized medicine across Croatia and Slovenia. Hello and welcome to the second episode of Healthy Glycans. At the beginning of our series, we explored what glycan biomarkers are and why they matter with our project coordinator, Professor Gordon Lauc. Now, we are taking a step further into their real-world use. And one clear example is the GlycanAge test, a biological age test that offers early insight into our body's immune health and chronic inflammation. Joining us today is Nina Lauc, co-founder and CEO of GlycanAge, a partner in the SynHealth project, to share her experience on how glycan biomarkers are becoming practical tools for preventive healthcare. Let's get into it.
Thank you, Nicolina. Thank you for accepting our invitation to be in this podcast for SynHealth. So my first question is, if you could tell us about your journey, basically what path led you from your background to becoming kind of a leader in personalized medicine?
I think leader is a big word, so I wouldn't add it to myself. But I've always been very entrepreneurial, so it's the only thing I've ever done, and it's been 16 years now in a certain vertical. So I think I did acquire some expertise. And then both of my parents were scientists, so I always had exposure to this space, really predominantly for them. And then I spent 10 years doing something else, more in the tech space. But my father kept telling me about glycobiology. It was his obsession since we were kids. Eventually, he convinced me on the science. I'm not a scientist, and I got very passionate about it. So it's really through his work that we got here. And I'm just kind of continuing on part of it, of bringing it into practice. So it's not just for research, it actually does reach people and clinical use cases, and we can apply it.
So is it a heavy legacy to carry on?
No, not really. I really enjoy it. I think it's a nice combination of different skill sets. There's, of course, legacy to it because it is his life work. But I think we did everything at the right time with having very different experience and backgrounds, and then seeing how can we do something together. But if we don't do it, I hope somebody else will. And both of it is a good outcome in the end.
So for our listeners who are kind of new to this in SynHealth and GlycanAge, how would you describe the GlycanAge test in simple terms? Yeah. What it is measuring exactly, and why should we care about our biological age?
So the biological age side is just a simplification on what we actually measure. And that's something that it's been more than 13 years since we published on it. So this was kind of like the ultimate simplification of your glycom, or like a small segment of your glycom that we measure that's related to immune aging. So we're measuring your health risk through life. And it's an early warning that would tell you up to 10 years ahead of time, at least in the studies we've done, that you're heading towards a problem. So it's an early health warning, which can also be quite specific in telling you which problem you're heading towards, and then giving you some actionable solutions of what you can do to prevent those problems ever occurring.
So now we will follow up on Gordon's discussion about the SynHealth project. How do you think the outcomes will influence GlycanAge fetus strategy and also the product development? So
our space is very complex, and it's not so easy to translate it. I would say population broadly doesn't understand this space, but for clinicians, they don't have a lot of time. And they usually, if they're experienced, they did their degree decades ago. And it's really hard for them to keep up with, especially this field, because they've never thought about it. So I think we have a big challenge in translating this into clinic and generally simplifying the science. And AI can help a lot with that. So I think it's similar to what the genomic space was facing a few decades ago. And we've seen how hard it was for them, for genomics to get into clinic, and there's still very little application. But one of the key hurdles was actually understanding what we're measuring and what impact it has on a patient. And I think with the support of AI, we can bridge this a lot quicker than the genomics, so we don't need to wait those decades. And we can hopefully put these tools into clinic with support of AI, reading the hundreds of papers, interpreting patient results, putting it together with other clinical labs. I think that can really make it user-friendly to doctors using it for the first time.
In your opinion, where does GlycanAge fit within the larger preventive healthcare ecosystem? It would be a thing that would be only used by doctors. Do you see in the future a strategy where we are talking about at-home use?
Well, it's used in home at the moment. So I think it depends on how far we can take it, but we want to be something that's accessible for everyone as a preventive tool. And that will mean from kind of decades before you're actually part of the healthcare system, because the healthcare system is a sick care system, actually. So you will only go to your doctor when you have, or your traditional doctor when you have symptoms and when there's an actual problem. And this is a tool that can preempt that. So one way that we're already applying it, which will continue to be a big use case, is individuals who just want to invest in their health preventatively. So they're trying to avoid becoming a patient. And then also we're hoping that healthcare will actually change to prevention and become actual healthcare. And currently in Europe, less than 3% of the healthcare budget is spent on prevention. And even when they talk about prevention, it's mainly early disease detection. So it's something that we know we should be doing within healthcare, but we're not doing it yet. And it is a responsibility of individuals, because a lot of it is based on your lifestyle. And it's a bridge in between your current lifestyle and when your doctor should eventually see you.
Now, what's the biggest challenge in translating this cutting-edge scientific research that, as you said, your parents are giving to the world for so many years into a successful commercial product?
Oh, I think it's the same challenge we've always had, which is most of the time, unless you're in this conference, which is a human glycan conference, people have no idea what a glycan is. So the first challenge is explaining what it actually is. And of course, it's easier to understand when there's a simple application like a biological age or menopause prediction test. It's something where you don't need to understand how the system works in the background. But the biggest challenge is making this something understandable. And that's trusted and accepted, because it doesn't matter the amount of science we do until it reaches mainstream, it doesn't really have an effect.
And we are almost reaching to the last question. But before that, have you felt any kind of special obstacles for being a woman in this biotech and health tech space?
Oh, I think that's honestly the wrong way to look at it, because it puts you in a certain mentality. And definitely I did have this mentality. I would walk into a room and think, oh, they're judging me. Not just for being a woman, but also I look a little bit younger usually. So they would always tell me I'm young and I'm going to be 35 this year. But I think if you walk into a room thinking that people are judging you, you already kind of start behaving differently. They can sense. So I take it off my mind. I try to act as if it's not a difference or a barrier. And I think that does make a difference. And I think then eventually it influences the bias, because I think the more usual it is, and there is actually a lot of women in biotech, a lot of very successful women in biotech. So I don't think it's a rarity, but it should be more common.
So I have a question for you from Gordon. His question is how to convert a problem into a solution, which can then be a successful product on a global level.
So I think what he's referring to is that often, but not all of the time, when we report somebody's age, we can't specifically identify what's driving it, because we haven't followed you through life. And we can now distinguish, is it coming from something hormonal, autoimmune, but there's a little bit, you can do a little bit with, and also if you know a bit about someone's health profile. But generally, we do detect problems, sometimes more than we give solutions. And also we don't have all the solutions. So we have many solutions right now, some lifestyle, some drug-oriented that would improve somebody's GlycanAge and glycan profile, but there's many more we need to find. So that's why we actively still do research that is also led by the company. So we're doing a lot, for example, with stress now, because we see that stress would have a huge impact. And we have a little bit of research on PTSD, but it's kind of like a more severe end of a stress response. And you also have the regular day-to-day stress, which seems to have as much of a dramatic impact on somebody's GlycanAge. So we're actively looking for solutions for stress. Now we can tell you that you might have a problem with your stress response, but there's not a simple solution to it. And I think that comes back to that there's no simple solution for anyone. There's no one size fits all. And that's going to be a forever quest. But actually, the more you learn about yourself, the more you experiment with things, the more feedback you get. And like, I do know what drives my GlycanAge, and I've figured out, I would say 99% of it so far, which I'm probably wrong about, but not everybody is there yet.
To wrap things up, so we have this quick fire round. So what's one piece of advice you'd give to a young researcher?
Oh, I mean, there are many options. There's not just one. So it's not like, you can dedicate your whole life to a single topic. And that's also a great use. But if that's not something you want to do, because sometimes it takes, maybe not even in your lifetime, they're going to actually see this applied or, go from mice to human, you can speed things up. So I think there's a lot of things do move quickly in entrepreneurship. And there's lots of researchers that do, after get their PhD, not just that, they go into commercial avenues and they're really successful. So I think there's a lot of different applications you can pursue, but having that technical background is a huge advantage. Whether you choose to go to the commercial side, which sometimes I see as the dark, but it's not, because it's just you get to apply your technology in the real world and see how it responds to it. And of course, it might not be what you first dreamt of, but it usually will have an application. It's sometimes searching for it. Actually, we had an interesting learning here where we were looking at menopause with GlycanAge, and we thought they were seeing menopause, and we were actually seeing the years before menopause or perimenopause.
That's
we
amazing.
didn't know this until we spoke to women, and they would tell us, yes, I'm actually still cycling. So what you're seeing is yes, related to my drop in hormones, but I'm cycling. And on the dots in the, or the Excel sheet, you would only see age between 45, 55, and you say, okay, this is menopause. But you wouldn't see that it could be the... Yeah.
So second quick fire round, second question. Fun fact about you or your work that you want to share with us?
Oh, I have no idea what's a fun fact. Well, I think the fun fact that my parents would tell as a silly story to friends is that I used to breed frogs in kindergarten. I would collect tadpoles, feed them microorganisms, and breed little frogs. And then I sold them to other kids in kindergarten.
So already an entrepreneur, right?
I didn't know what my talents would be, but this was very clear early on.
That's so funny. And then the last question, which is, what question would you like to leave for our next guest, which is Ivana from Llanos?
Ivana, I would want to know her secret on how she does it all. So how she balances 3 little kids, a demanding career, and just kind of the crazy ambition.
Thank you so much for being here.
And that's it for today's episode of Healthy Glycans. Thanks for listening, and follow us on social media for updates from the SynHealth project and when the next episode is out.